So my dad is an orthopedic hand surgeon at UConn in Farmington. Um, so he deals a lot with like any bone issues in the hand, so like fractures. But a lot of his surgeries are elective, like carpal tunnel syndrome, arthritis, and treating things like that.
My dad is a state trooper for the state of Connecticut, and he'll typically work at the state troop at the airport for Bradley, and otherwise he'll be at Hartford.
Well, my mom is a nurse practitioner. She works for a nephrologist, and my dad is a police officer at LAX.
So for me, life has been pretty simple. Just kind of go to class in my room, and then other than that, it's just kind of been hanging out with my family, which has been a nice change. Like everything's slowed down in some ways. But it is tough, like not being able to see many people because my family, with my dad going to the hospital, I mean, he operated on a COVID positive patient on Tuesday, and we are a risk to other people. Like, as much as you want to be able to say, oh, like, we probably don't have it, you probably don't have it, we can hang out within 6 feet apart. We are like a risk to other people's health. So we have had to stay more quarantines than most families would during this time, which has been tough, but it's been, I think my family's made the best of the situation.
Honestly, I mean, like, normally when I'm at Loomis, I don't see him a lot anyways, but I haven't seen him a lot lately now, like, considering that I'm home. Like, I know today I had school, and then I had a meeting after school, and in that time, like, he left for work, and I haven't seen him for over 24 hours now, actually. So it's interesting because he definitely works off hours. Like, I have school, and then typically once the school day ends, that's when he goes to work, and then he doesn't come home until after I'm asleep. And depending on what he works, sometimes he'll work overtime jobs for construction or extra shifts that guys are taking off because of COVID. So he's at home a lot. So it's it's interesting because it's like I'm home and I don't see my dad. It's weird. I mean, it's typical, but I think that's one thing.
Well, if anything, it kind of like feels like it hasn't really changed too much. Like, we're fortunate that my parents aren't in a super like threatening position with their jobs because my mom works for a nephrologist. She's supposed to help the patients with kidney problems. So, like, sick people aren't supposed to go to the office. And my dad, because there's such minimal traffic at airports, like the airports are so empty right now, he's not really coming into contact with people that aren't his coworkers, but he's still trying to like maintain a safe distance from everyone because one of his coworkers did die from coronavirus.
Kind of been, since my dad's been operating less, it's been nice to have him around the house more. So we've been playing a lot of like games together as families. We've been going on like runs as a family on weekends, like in the woods behind our house. Yeah, we've been watching a lot of movies and TV shows, which has been, it's been fun to kind of like bond with them over new-ish experiences. Yeah.
Honestly, we haven't been going out much. Like, I think staying home is definitely something we consider more, considering that he could be bringing in any sort of virus or sickness to the house, I guess. I know, like, there was one time where the entire family got sick, so we all, like, had to lay low for a little bit until everyone was better. Otherwise, we're just more cautious, wear the mask. And my dad, he's still working, but he tries to stay out of the involving with as many people as they can. Like, the state police does have rules now that incorporate like social distancing more as best they can and better working in an environment, but lots of Lysol.
Me and my sister, personally, we feel like it's best to just focus on our schoolwork and like try to go about normal lives, like even being stuck at home. We take like our grocery store trips too. We go for runs. Um, so we try to cope by just like being normal, but also like my parents have kind of a routine when they get home, My mom she always makes sure that she showers when she gets home, and then she changes into like her home clothes. So it's like making sure that she's like extra clean when she gets home. And my dad usually gets home like really late at night. He always leaves his police uniform at work, and like he tries not to bring any stuff from work home.
I think that our healthcare workers are out there and they're doing their best to kind of keep the virus under control in that respect. But I think the best thing that society can do is just kind of social distance and stay away from each other and follow the advice of healthcare professionals, just so we can get back to school in the fall and we can resume normal life as soon as possible if we take the appropriate steps at present. So yeah.
If you don't have to go out, don't go out. I know that's something everyone's been saying, but just stay home, because the less people that can cause trouble in the world, if that makes sense, having less people out, it definitely helps them. Like, they've had a lot of fatal accidents. I know lately, like, just a lot of crashes on the highway, that takes up time and reports and dealing with more people and interactions and touching things that can come back to the household. So that's one thing.
And like having parents who still work, it's nerve-wracking, like when you wake up in the morning and like you feel like you're getting sick because of something that your mom or dad could have brought home, or like when your parent isn't feeling so great either. We've definitely limited contact, which kind of sucks because I love my mom and I like to hug my mom,